My name is Heidi Williams. I'm the volunteer and marketing consultant with Genesis Hospice Care. Hospice care is when a patient has a life-limiting illness of 6 months or less and is certified by a physician that says that they are in that time frame. That is when hospice is able to participate in the care of the patient. My passion for hospice care started almost right away. When I began working with Genesis Hospice Care, I realized that the care that I'd been giving for patients at end of life wasn't really the total care that hospice care can give. Our group takes care of the total patient, not only the medical needs, but also the spiritual needs and the psychosocial needs of them, as well as support and education for the families. Qualifying for hospice care means that the patient is given a certification from the physician that says that they have a life-limiting illness of 6 months or less. And it's also when the patient is not wanting to return back to the hospital and seek aggressive curative types of treatment, but are ready for the comfort-focused quality treatment that we can provide. Some of the unique services that we provide is a community of care that begins with our nursing staff. We're available 24 hours a day, 7 days a week. When patient or family call into our office, they're going to be greeted by a live person that can help them and possibly take care of their needs immediately. We also have chaplains who will visit and can become involved in their care by providing spiritual support and care for them as well as their family members. Our bereavement services are offered pre-bereavement, providing support to the family and to the patient in anticipation of death, can give support to those little ones that are attached to that patient as well. That's especially hard for our little folk. And also she is available for 13 months post-death. So by means of note cards, letter writing, mailings monthly for the 13 months post-death. We also have volunteers that can be involved in the patient's care, as well as our nursing assistants. What I wish the community would know about Genesis Hospice Care is that we're your community hospice. We've been in this community for over 30 years. We are your friends, we are your neighbors caring for you. We are unique in the fact that we have Morrison House that is a 7-bed unit. We use that Morrison House for patients who are having pain and symptoms that are out of control and can't be cared for comfortably by their families at home. This is always intended to be a short-term stay because we ultimately know that patients would rather be at home with families, but we know that can't always happen. So we are here for that support for those families and patients. We also care for patients in their homes or home-like settings such as nursing home or nursing facilities in 6 counties, Muskingum, Perry, Morgan, Coshocton, Guernsey, and Licking counties. What it means to our community to have the compassionate care that hospice provides is the fact that we help them decide what their plan of care looks like. Everyone has a different idea of what their quality of pain control, symptom control is, and how they want to be cared for. And Genesis Hospice helps them decide what that looks like from the very beginning.